today. Please state your name and date of birth.
Rose Sankey, 12/5/2000.
Okay, this is the correct patient. My patient is interested and engaged. Today I'll be performing a focus exam on you today. It should take between 5 and 8 minutes, and I'll explain the exam as I go along, but please feel free to stop me at any point if you feel uncomfortable or have any questions. Before we begin, can you please empty your bladder and put this gown on with the ties in the back? And are you comfortable in this room with respect to warmth and privacy?
Yes.
My patient is prepared for the exam and comfortable within her surroundings. So now I'm going to start by asking you a few questions. Have you had any difficulty or noticed any changes in your ability to move about?
No.
Have you noticed any differences in your muscle strength?
No.
Have you had any problems performing your usual daily activities?
No.
And have you had any pain in your bones, muscles, or joints?
No.
My patient denies any neuromuscular complaints, but if she had reported symptoms, I would assess them using Olgart's ice and further assess them using special age-appropriate assessment tools. So now I'm going to ask you to stand up, Holly. My patient is erect, her body is symmetrical and proportional, her limbs are straight, symmetrical, and proportional. Her knees should be in alignment with her hips and her ankles, and my patient is able to maintain balance. So now I'm going to look at your back. There's no deviation in the spine. The vertebrae are aligned, the spine is straight, the cervical, thoracic, and lumbar curves are present, and the shoulders and hips are level and symmetrical. So now I'm going to ask you to perform a few movements for me. Can you just tell me if you feel any pain when doing so? So lean forward from your hips, and lean backwards, and to your right, and to your left. And can you rotate to the right from your trunk, and to the left? Okay, my patient is able to engage in range of motion without any pain. If you could just be seated on the exam table for me again, and I'm just going to feel over your back, and then you could just tell me if you feel any pain or tenderness. So the neck and spine are straight and in alignment, and
I don't feel pain.
okay, and there is no pain upon palpation. So now I'm going to look at your arms and your hands. So the arms are symmetrical and in proportion to her body. The muscle groups are generally symmetrical. There is no atrophy noted, and there are no twitches or muscle spasms present. So now I'm going to feel your arms and your hands. If you could just let me know if you feel any pain or tenderness.
No.
So there is no pain or tenderness reported upon palpation. There is no pain or edema noted in the shoulders, arms, and fingers. The joints are symmetrical. There is no redness, edema, or enlargement of the joints. And I'm going to feel your arms for temperature. Okay, the temperatures in the joints and surrounding musculature is uniform. There is no increased warmth noted. So now I'm going to ask you to extend your arms out and upwards at a 90-degree angle and offer resistance and we're trying to push them towards you. Okay, the tricep strength is equal bilaterally at 5 out of 5. No pain reported, and then do the same motion and offer resistance as we're trying to pull them towards me. Okay, the bicep strength is equal bilaterally 5 out of 5 with no pain reported. And if you could just squeeze my hands for me. Okay, grip strength is equal bilaterally, grip is firm, and with total flexion of the fingers. So now I'm going to look at your legs and feet. The muscle groups are generally symmetrical with no atrophy noted. The feet are in alignment with the lower legs, and the toes are extended and straight on each foot. So now I'm going to feel your legs. If you could just tell me if you feel any pain or tenderness.
No.
Okay, there is no pain or edema in the knees, ankles, or toe joints, and the muscle tone is firm. And now I'm just gonna feel the temperature in your legs. Okay, the temperature in the joints and surrounding musculature is uniform. There's no increased warmth noted. And now if you could just extend your legs up for me and offer resistance as I try and push them down. Okay, the quadricep muscle strength is equal bilaterally, 5 out of 5, and then I'm going to try and push your legs towards me and just try and keep them stable. Okay, and then the hamstring strength is equal bilaterally, 5 out of 5. Is there anything else I can do for you today before I do my safety check? Thank you.